So great stuff, and keep the questions coming in. This is session 3, so on your form you can identify how you want to direct your question. So first of all, do the three of you have questions for each other? Because in some ways you overlapped in interesting ways, the ways in which you engage people in your communities and the way you see people come alive, Nick, in your game, and the way you see people actually empowered to do stuff seem to be very, very much related. How do you see your work overlapping?
I actually wonder whether, I wonder what the sort of, these once we talk about them on stage like this, it sort of seems obvious. You were saying that like, these solutions seem obvious after they're there, but I wonder what keeps us from something specific, something about going to the people who are most directly affected. I find that, like when designers sort of have this ethos that we're supposed to go and work with users, and despite the fact that we always talk about that, it's much more rare even than I think we like to think it is. And whenever I do that, whenever I sit down with a group of we call them users, when I sit down with a group of people who are actually affected by the thing that we're actually designing for, I'm surprised at how much they have to offer. So I wonder what are the things that keep us from doing that.
It seems so easy when you finally do it.
It's easy, it's powerful, it is in fact the only way to actually find solutions, and yet even those of us who preach it sometimes have trouble remembering that you have to go talk to people in order to solve that. So I wonder if you all have any thoughts about why we have so much trouble with that.
I think it's a cultural thing. I think that, I see it more in engineering. I think there's this notion that we're the experts. And if somehow, I think nobody really says it, but the reality is if users start solving these things, does it put us out of a job? And then why are we relevant?
Right, right. And I thought about that too. I thought, about the themes. The theme of we all are experts, we all can offer solutions, think team. I thought about gratitude and how we need so much of that. I think I'm going to borrow those little ships just to the whole economy of gratitude, where we all in our offices and with community members exchange this and say, thank you so much, for caring about kids with disabilities and creating a group. Thank you so much for this and that. I think we need to be aware of that. I also saw and believe, but I saw how it's true that solutions might be complex, but they don't have to be complicated. And it's true that we can simplify without being simplistic. And that there is something about complications and glamour. And there is something about this is mine, and then I can make money, be famous. And then what happens when all of that gets in the hands of people? And it's a no mystery approach. And how can we feel happy with no mystery, with inclusion, with thinking together, and unlearn glamour and learn collectives, no?
Yeah. Well, America, how do you keep people from burning out in your work? There's a lot of questions about, you knock on doors, some of the doors get slammed, and how do you empower people to go back again and again and again?
It's all about what you want to accomplish. Imagine that you are part of a sales force, and we are selling that, the invitation to participate, the hope of better communities. When you go and knock at the door and sell a vacuum cleaner, and people don't open the door, you don't say, I hate you, and I won't come back because you didn't buy my vacuum cleaner. It's like, okay, we are here, we know that some people are ready to participate, and some people, it takes longer. There are horrendous experiences about participation. From the teacher that didn't hear you, to the doctor that told you that he was the doctor. Why are you explaining diabetes to me? I am the doctor. Don't tell me about this and that.
So you have to hear all those stories before people get involved.
You do, but you also have to have faith on people, and you have to celebrate. And again, to the point, we have to celebrate our inventions. We have to be grateful. I have to remember that these moms now are creating a dance group for kids in the neighborhood where we didn't have after-school programs. And that inspires me to have the long fight. You know, so I think that not burning out is part of a design, and you have to design your work and your experience and the conversations with people in a way that feed your soul and your hope, not only that gets the work done.
Have you worked with radiologists, physical therapists, or other healthcare workers, Jose?
Yeah, absolutely.
And
you mentioned physical therapists, for instance. I think that the accessibility community, they are way ahead of the curve in this, because the reality is, it is in a sense this long tail market where you're not. If you go to a traditional occupational therapist unit at any health system, you'll find a lot of craft materials. Yeah. It's what they do. It's already in their nature. And we do work a lot with other physicians as well.
But it's also, if you go to occupational therapists, at least in the last 5 years, you'll find them horribly beleaguered by having to justify their work because it doesn't fit any pre-existing outcomes model in terms of providers or reimbursement. And so these innovators who've been doing this for years on the front lines are also getting told, what is this? What is this all about? Why are we doing this? And it's a huge conflict.
Absolutely. I mean, how do you bill for something like this? If Jason uses that shower, like what is he going to punch? I think that we can borrow a little bit from surgical units. Use a lot of innovative approaches sometimes, and as it just gets absorbed internally as part of the productivity cost of the hospital. But
nobody argues with surgeons, but they argue with occupational therapists.
Yeah, and I think it's again up to us to continue to reinforce the fundamental outcomes that this is good. I mean, we get people in Silicon Valley making a case for a nap on a phone that blinks every time you move, and making a case on how it's going to change medicine. I'm pretty sure we can make a case for something that basically supports your entire body, or makes you feel better when you're sleeping, or any other patient-centered devices that actually are being made every day from these people.
And part of it is that impatience that Doug talked about. You have to be impatient to want to do it now. Here's Gift of Grace. As a patient advocate and someone involved in healthcare policy, the last 6 months of life to me is the second item needing resolution regarding healthcare costs. If you come in contact with someone who is in that last 6 months, how does the game play out in that situation?
So when we actually, we're a group of designers, so we design for we pick a specific population, we try and get very precise and clear about who we're designing for. We knew exactly who we were designing for. We were designing a game for a 50-year-old woman who is sort of the unnamed caretaker of the family. And I think I certainly have this in my family. I think most people have somebody like this who is sort of behind the scenes, always making sure that everybody in the family is okay. And we wanted to do something that would assist them. And that was our market for the game. And then very quickly, as soon as we released the game, people started using it in ways that we didn't expect. And I think, we spent a lot of time trying to be good designers, to really design for people, to listen. There was a huge number of iterations where we would, someone would come in, and we had a disability rights activist come in and review our questions, and just basically took 10 of them and said, you can't ask these questions. If you had asked me these questions before I had my accident, I would have answered completely differently, and you don't understand what experience is. So we listened to all of that, and I think because we listened to that, we created something that is accessible to everyone. So we hear very frequently we heard this from Nazea's family. I sat down with Nazea's family and they said, thank you so much for making a game for kids. We didn't make a game for kids. We hear that from people in the last few months of their lives too. Thank you so much for making this game that is specifically for my population. But I think that's because it's, we took a lot of time to make sure that the questions didn't have assumptions built into them and really focused on gratitude as the thing, because I think gratitude is a universal. I think gratitude makes these conversations possible. But I think, we get a lot of good response from people who are in the process of dying, who know they're in the process of dying, and want to have conversations and don't know how to start them. And we're just we don't see ourselves as, we haven't come up with this grand solution. We've come up with a way that helps people sort of take those first few steps, and then we trust very much that they can do the rest. And I think that's an important piece of the design, real faith in people.
So is there a personal motivator in this game for you, Nick? Some people want to know if there is. I mean, I suspect you didn't just get asked to do this from, designing like iPod interfaces or something.
No, we actually came up with this. We wanted to do this on our own. This was a project that we decided to do. So I think most people have, when you, at least by the time you reach a certain age, you've lost somebody who really means a lot to you. And I certainly lost somebody who was extremely close with me and whose death was extremely painful, and who worried a lot about legacy. And I definitely had her in mind, and everyone on the team had somebody. One of the partners, Jethro, lost his dad when he was 20, and he actually infused all of our work. We've been together, Jethro and I have been working together for 18 years. We've been a company for 10 years. And even though we've done lots of other different kinds of work, we focus only on end-of-life conversation now, but we started off as community organizers. We were designing tools for community organizers. But even then, everything that we did was infused with taking grief seriously.
That's right.
And not papering over it, and not understanding it as a thing that if you exercise it, you can get better at it, and that by learning to deal with grief as a group, you can handle challenges. And that actually comes from community organizing. That's a clear thing in community organizing, that you have to deal with these issues of grief, not just grief around people, but grief around losing battles. When you lose a battle, one of the things about community organizing is you lose a battle, you got to take that seriously, take that grief seriously. So that's, there's grief and grieving and loss has been built into our company since it was founded. It just sort of didn't surface in this way until now.
So politics of health in Santa Ana, politics of death in these table games, politics of duct tape in your case. There's a politics associated with mobilizing people, and once you get people mobilized, there's a political dimension to it, and those tools come into play. That's really, really interesting. Who funds Latino Access?
We have money from private foundations, very little, almost nothing from government, because they want you to do what they want. And we do a lot of fundraising and getting more and more sophisticated in how to get that money that can be unrestricted. So you can do what really works without so much distraction and fragmentation. And if I may, I would love to make a comment about the whole personal motivator. Because I do believe that the personal and the professional is the same. And that's probably why it's easier to talk about grieving and losses and gains and success and celebrate and be human. I think that the personal is what brings the beliefs and the passion. And we tend to tell to people in institutions that they need to leave the personal out. And I don't know how you do that. Where do you put it? Like, do they have a bag where you put your dreams and your passion and your beliefs that you check out the door? And actually people believe that and start repeating that. Oh, leave the personal out. This is personal. Don't get involved. The personal, the personal. But when you get trained in that way, then the doctor that is listening to the little kid and the family, the mom is saying, my kid doesn't have a place to play. I mean, we live in an apartment where kids cannot go out and play. Then the doctor says, well, you need to read the food labels better. And you know, Pedrito needs to exercise. And he's not listening. But when that doctor that is a mom is listening to this mom, she cannot avoid but to get angry and worry that Pedrito doesn't have where to play, because the one connecting with that mom is not just the doctor. And we have trained to fragment ourselves so we don't feel, and that is a problem. I think that we need to be very subjective to be objective, and that we need to be holistic to be specific. You know, we need to be personal to be better professionals, and we need to debunk the myth that the personal and the professional are separated. Not to say that we need to hear all your gossips, you know, and your drama.
But you'll hear that anyway.
Drama.
You will hear that.
You leave your drama, but bring your personal. You know, so it is different. I also think that.
But let me stop you there for 1 second. How do you solve the problem of he has no place to play? How would you at Latino Access go about solving that problem?
Right. So when we hear that, we involve people in finding places to play. We created a park with the community. We create places where they can play in parking lots, but we don't stop there. We fight for policies that can finally regulate the alcohol consumption and take the bars out, or stop the bars from coming in and put in parks. It's almost like cities around the nation put the bars in poor communities and the parks in rich communities. And yes, we need to fight that. And that is the inconvenient. Like Alan Gore used to say with the inconvenient truth, the inconvenient truth is that we have to move from our technical role in a more of a policy role and get into politics and vote and get organized and express this, because at the end of the day, this is not only their community, this is our community, and it will come back in a form of that you don't want to see. You know, so without equity and without balance, that unbalance will eventually come and bite us back. So I do think that commitment and that reflection is worth a deep conversation.
You know, Dianne Feinstein, I think, is going to retire soon. Just saying.
So you are running.
Yeah. How does Maker Nurse work with psychiatric nurses? It's a question one of our people had.
We haven't done a lot with psychiatric nurses, probably because of the type of hospitals that sometimes they're. We have found most of our nurses have come from med-surg, critical care, NICU, a little bit of the ER. I think where you have more long-time critical care time with patients. But I can't give you a good example of a psych nurse.
And this is, in terms of applications that you haven't thought of, Nick, have you thought of gift of grace for non-terminal situations, for conversations that are difficult but don't involve death?
We have, although I think there's a real value in focus. We decided that we were gonna focus on this very specific problem 3 years ago, and because we decided to focus, we really got deep and understood a lot of stuff that I don't think we would have done if we were sort of doing a more broad thing for conversations. I think when you do that, when you focus on something, you wind up creating tools that are usable in other situations. And we took lots of things when we made this game. Many pieces of the game, there's lots, I just explained a couple of them, but there's many pieces of the game that came from earlier games and tools that we created, some for our own. Many of the tools that we had created were tools for our own company to help us. We're a small company. If you've never run a small company, I won't tell you that it's easier said than done. You just have to experience it. It's a very difficult thing to manage a small group of people. And we designed these tools in order to help us get through to deal with the emotional aspects of running a small business, and then build those into it. But so I think there are adaptations in the future, but we really want
celebrity gift of grace.
Sure. We'll eventually we're in talks for. I think there's the Game Show Network guys here.
Right.
I think I think eventually, we will do other things, but right now our next things that we're doing are all around serious illness and death and dying, and how do we build other tools? Because this is a great tool for a specific kind of situation. It gets used in lots of places. It gets used in ICUs. It gets used in pediatric cancer centers. It gets used with support groups, but there's still more tools to make, and I think we're sticking here.
Who and what do they say is the obstacle in using the expertise that you find that they have in these make-or-nurse sessions that you do? Who do people tell you is telling them no when you're saying yes to them institutionally?
Yeah, we're in the middle of writing our manuscript. I mean, it's just, you have a lot of data and getting it published. But I can say that it surprised me when I found out. It's other nurses. We were so protective.
Hell is other nurses.
Yeah, and they have a saying. I just, in no field have I ever heard, they said, yeah, nurses eat their young. And when I heard this, I think I said an expletive out loud in the middle of the conference. And because I work with undergrads at MIT, and my job is to make sure that they don't really pay attention to me, and that's okay. I think that's the beauty of having that young mind that can then surprise you with things. And we were so protective of them being, I guess, overruled by doctors. That was our number one theory, actually, that they were going to be constantly overruled by doctors. And if anything, we actually identified a driver in the data. We ended up dubbing it the benevolent physician. This sort of like almost Godfather-like role where this physician says, this is your thing, I recognize it, and I'm going to let you keep your thing and support you, in the background. But the number one force in the field that is keeping them is senior nursing staff. And so it's been our job, in a sense, to call them out on it and say, how is this cannot continue. You're going to just exterminate the field and they're going to continue to go underground, and then we're going to have these same conversations about scope of practice and who gets to do what when the very innovators in that field are being squashed by the same guild, basically.
It's fascinating.
Yeah,
and
yeah.
Again, when you discover something unexpected, and then it gives you a whole new insight.
Right.
And again, it comes back to the innovation involves questioning your assumptions and dismissing and putting your assumptions aside, because you have to see the system for what it really is doing.
Yeah.
Have any employers ever sponsored My Gift of Grace? Yeah? How has that gone?
It goes pretty well. I mean, we work with healthcare systems and employers and other groups that recognize the need for this. And it's, we are sort of in a nice position because we're our own company. We're completely owned by the founders, so we are in a position to be able to say we're doing this because we think it's important, not because it has an economic driver or things like that, although it does. So yeah, lots of organizations have come to us and said we want to sponsor this for our employees, or we want to sponsor it for our community. I think, though, that we still, while there is a lot of talk about how important these conversations are in healthcare, and there is a lot of talk about it. I mean, the Dying in America report from IOM that came out about a year ago, there's lots of talk about how important these things are. But community organizing, which is what these community events really are, is hard work. It takes a lot of people, and getting it right takes skills. I don't think, in general, I think we fall into that category a lot, where people think, oh, well, you're doing a good thing. We don't have to pay to make that happen, right? So I think that there's part of our mission is to call out healthcare institutions and say, if you're going to say this is important, you're going to make it actually work the right way. We're going to really engage the community. We're not going to do this on the surface. We're going to actually listen to the community, let them figure out how to make this invitation, do this organically, and really work with the people that you say that you want to work with. And that is a little bit of a struggle with us. But the good thing about these events and I hope you all will come try this today, is we designed the game pretty well, and it really works. And once you sit down and people start playing it, the value of these conversations is just right there on the surface.
Yeah, I think that one of the issues with innovation is that sometimes it's not validated in ways that our brain recognizes. You know, so at Latino Access, now we are getting invitations from healthcare organizations and HMOs and insurance companies because they want promotoras to help with utilization. And they are willing to pay for that. So you can say that that is a validation from the dominant paradigm, promotoras work. But actually, the real challenge is to validate the many other things that are happening, and maybe the dominant paradigm is not ready to validate their wisdom, the fact that they are experts, the fact that they are improving their community, their own ways, the ways they talk, the way they solve issues, to validate inventions that are going to be shared at low cost or for free. Who validates that? And it is an issue for us. I mean, we just finished writing the book about Latino Access, and it's going to be published in December. And one of our main struggles for 8 years was not to say what is wrong with us, but what is right with us. Because the main validator of our work is the community itself. So what we need to fight that. We need to say, what am I waiting for? Am I embarrassed that this is something that is community? Am I embarrassed that this is something that is not going to make anyone rich? But I hope you are protecting those things, because someone is going to get that and make a lot of money. And then the whole access goes, through the window, right? So we have to think, what is keeping us from innovating? And what happens is the validation comes from kids that now can play a game so they can die with dignity. What happens if the validation comes from women that were victims of domestic violence and they are taking back their streets? What happened with that validation? I think there is a lot of food for thought in terms of the unlearning.
What does that 6-year-old, the promotores, grow up with, who is activated by Latino Access, who goes around to those doors and knocks on the doors? What does that person have by the time they're 18, 19, 20 and ready to join the community?
Well, many of them actually work with us now as adults, and they are leading change. They have joined the teams as young adults. Many of them are representing their communities in these coalitions. Many of them actually go to college because they receive the support to continue. And many of them are a big threat to people that want to be mayors of Santa Ana, because now they are ready to participate. And that is important. These are kids that met Senator Lou Correa when they were 8, that met our city council members at 10. I mean, there is something that happens in your brain when you find that you have the right to make your public officials accountable, that you can sit with them to talk. There is something that happens. And it's the opposite of learning hopelessness, is learning hope. So what happened? You become optimistic, you believe in change. What happened when people believe in that? I leave it to you.
And health innovation drives a whole set of tools that reinforces our democracy, which is what was said yesterday in the Pechacucha, one of the presentations, which was so great. And they were also talking about communities that are in difficulty economically around the country. That, the promotores remind me of a lot of these coaches that are used in the sort of last mile questions of Obamacare and insurance. There is so much value in these individuals who can bridge this kind of last. There's so much of an innovative space there that doesn't get necessarily reimbursed, but you're showing how the community can benefit from it. You're showing how the invigoration of that kind of last mile, patient to family kind of space has so much value in it, and you're showing that on the clinic sort of floor level, there's a huge amount of intellectual property that just goes by the wayside.
Well, there may and there may not be. I think that I think it's you mentioned. I have to clarify that. I think that one of the interesting things is there is no intellectual property in a peanut butter and jelly sandwich. Okay, And if you went to a restaurant and you got charged or saw on the menu $12 peanut butter and jelly, I've seen those. And with a 9-year-old, it hurts when that happens, and you're on the highway, and that's the only restaurant in the, for 60 miles.
It's brioche.
Right.
It's not
Right, it's brioche. That's right. But the reality is, we know enough to know, okay, that is a ripoff.
That's right.
And I think what we're trying to do is, sure, it generates some intellectual property when it can be, but also at the same time demystify the fact that, are you kidding me? This is a glow-in-the-dark cap on a prescription bottle, and you're calling it, the nighttime medication storage device. I kid you not, I see that. And so when they realize, we just make this, we go to Michael's, $5 later, we're done. I think that's what we're trying to do a little bit more. And then, to your point about validation, I think that in medicine, of course, we need validation, and there's lots of pathways to validate it, but not, everything doesn't have to be an RCT. I think what we're missing a lot is bridging back this culture of experimentation, because the tools that we're generating, whether it's tools that you're generating or the policy tools that we're generating, the cycles, I think, are much, much faster than the traditional cycles of evaluation and validation that we have in medicine. A Fitbit model can change in as little as 7 months, and by the time you're finished with your R01 to see if it worked, Fitbit may not even be around. So I think we need to just re-invite a lot more experimentation into the community, into the conversation.
Act now, be impatient, recognize the value of what you're doing. It comes with the success that you're having, and figure out what you can do now, as Doug suggested. That was a great discussion from Dianne Feinstein to peanut butter and jelly sandwiches. That's a great range of stuff. Thanks so much.